Good morning, I'm Jessica Lovell. Today we bring you an encore presentation of one of our very favorite programs. We'll still be live with you this summer, Monday, Wednesdays, and Fridays, and then come September, we'll be back with our regularly scheduled programming. Until then, enjoy this encore presentation and make it a great day. Coming up today, he has Parkinson's disease, but Parkinson's does not have him. What it's like to live and live well with a disease that currently has no cure. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Nearly 1 million people in America live with Parkinson's disease, and that number is rising, according to the Parkinsons Foundation. It's a disease without a cure, but we have gotten better and better at treating the symptoms and slowing down the progression. Today, we are hearing from one man who keeps his body and his mind strong despite his diagnosis. John Reinhardt is here with us in the middle to share what it's like to live with the disease. He was diagnosed 7 years ago, correct?
Correct.
And he had an implant in his brain that has really kind of changed things for you. So we're going to hear about that here in just a moment. And we're going to also talk with Dr. Kelvin Au, movement disorder specialist here at the University of Kansas Health System. Great to have you with us. John, take us back to the first signs of Parkinson's disease. How old were you? What did you notice first?
What I noticed first started right here with the thumb, just a little quiver, and I thought, that can't be good. And I didn't share it with anybody at first. I just kind of watched it, and it got increased in frequency, and it increased in strength. And finally, I showed my wife, and I showed her what was going on with my thumb, which eventually became the hand and my leg as well. And she's a nurse, and she said, we got to get you to a doctor, see what's going on. And so that's how it started. Now, looking back, I know that I had Parkinson's far before the tremor started in my thumb and in my hand.
What age were you at that moment?
I was, when this started, I was 63 and had just retired. And quite frankly, we were scared. We didn't know what it meant, really. I took out Social Security because I thought, I took it early because I thought, well, I better cash it in. I'm not going to get to use it. We thought we're not going to get to travel like we were planning and all of that. All of that proved not to be the case. We did get to travel.
But interesting, though, that you were planning ahead, and your thoughts immediately went to the worst.
They did, and I think that happens to most people that have Parkinson's. They begin to think, oh, what is this going to mean? Because until you have it, you really don't know anything about it.
And your thumb, was it moving constantly or just would come and go?
At first, just come and go, and then it started all the time.
So when were you officially diagnosed, and what was it like when you got the diagnosis? Did you feel empowered?
Not at first, no, not empowered. But I was officially diagnosed 7 years ago, in April, 7 years ago. What you set out to do then is to learn more about the disease, both from your neurologist, from other people who have it, and from online resources. There are a lot of resources out there. So you begin to understand what the disease is, and then you learn that you can live well with it.
So Dr. Au, what is happening inside the brain? And kind of take it down so people like me can really understand. What is happening in the brain of someone with Parkinson's?
Yeah, so Parkinson's is a neurodegenerative condition, meaning that the brain cells gradually over time are degenerating. What does that mean? It means that they're dying off. The brain cells in what we call the midbrain that produce dopamine are dying off. And dopamine is a neurotransmitter that you may have heard of. It's involved in a lot of different things. Your reward system, you've heard of that, mood, but it's really important in motor aspects of control of your body parts, your hands, your thumbs, and if you don't have that, then you can have the symptoms of Parkinson's disease, which are slowness, stiffness, tremor.
And that is what we think of when we think Parkinson's is tremor. I remember my grandmother had Parkinson's very, very severely, and I always think what it would be like if she was living today with the options. But all I remember the biggest memory of my grandmother was her shaking hands. They just shook so uncontrollably. You mentioned some other symptoms. What are some other initial symptoms that somebody might have that might go, this might be Parkinson's?
Yeah, I mean, the tremor, like you said, is the most visible symptom, is what people pick up on the most. But people say the motor symptoms are actually the tip of the iceberg.
True.
People can have multiple systems in their body affected. People can have loss of their sense of smell and taste that can be altered even years before they start having a tremor. Their sleep can be affected. Parkinson's can cause you to act out your dreams at night. You can have mood difficulties, including depression, anxiety, and apathy, and also your cognition can be impacted. The list kind of goes on.
So there's things that we see and things that we don't see.
Yes.
So how are we slowing down the progression of Parkinson's?
So right now we've, in terms of asking that question, how do we slow down the rate of Parkinson's? It's a very common question in our clinic. Exercise is the number one thing that we recommend at this point, high intensity aerobic exercise, but as well as strength training and also flexibility and stretching exercises. Right now we don't have, at least just yet, kind of widely available medications that slow down the progression. But we're looking into it, and there's ongoing research that with new medications that can help that.
So John, what were you noticing as far as, from when you first started getting those symptoms? Were there things, what couldn't we see?
Well, irritability, anxiety, you don't see those, but they're very much there and very much a problem.
Did your spouse notice these things?
Oh yeah, these were things I encountered. Fatigue, that's crippling. I would get up in the morning and sleep all night and have to lay down. Wave of fatigue would just come over me, and I'd lose a couple hours just sleeping through the morning because of it. Constipation. People don't think about that, but that can determine whether you have a good day or a bad day.
Amen to that.
Handwriting gets small, gets cramped. Quite frankly, I can make some notes and come back to them 5 minutes later and I can't read it. I can't read my own writing. If I have to go to the doctor's office and I know I'm going to have to fill out a lot of forms, my wife goes with me because I can't do it. Sleep problems, Dr. Howell mentioned those. Insomnia, I don't have that problem, but that's a problem for a lot of people. The problem I have are night terrors. REM sleep disorder. Someone is either in the room, someone or something is in the room or trying to get in the room, and I will wake up screaming.
Really?
And that happens probably on the order of once a week. Let's see. You mentioned loss of sense of smell. I flunked the smell test at KU. I can't smell. I quit drinking coffee because that wonderful aroma that you get is just lost on me. And so the pleasure of drinking coffee is gone.
What about speech? That's something that can slow down. I don't notice that with you, John.
I don't have a problem, at least I don't think I have a problem with that, but I know that many people do, and it's supposed to be soft-spoken.
Yeah, exactly. People can lose articulation and also just soft speech. We call it hypophonia. They're not able to project as well, kind of generate that volume. And other people say, it's difficult to hear you.
Very difficult.
John, you were really active before this, but you're active now. You are in a class called Rock Steady Boxing, a program that's specifically designed for people with Parkinson's disease. And you told us the workouts are one thing, but it also has served as just a real good support group for you in some way, right?
Yeah, it has. First of all, Dr. Howell mentioned that exercise is one way that we know will slow the progression, and that's why it's so important that you do something, whether it's Rock Steady, which is boxing, or you're swimming, or you're biking, or you're walking. You've got to move with Parkinson's. That's critical. What I found though with Rock Steady is that you get to know the folks. They get to know you. They're either been where you are or they're going to be. What I mean is there's people with all different levels of progression that come into the boxing. And guys particularly don't like the idea of a support group. They'll say, I don't need that. But with the Rock Steady, what will happen is you'll encounter people that they've gone through it. They can share with you. You can talk to them in a way that you can't talk to other people. they know you from the inside out, and neurologists know you from the outside in. And so you meet these people, and for example, there's a couple of folks that are in their 80s. I'm 70. They're in their 80s, and they come every day to box, and it's inspirational to see those people. So you get that kind of support without identifying as a support group. You're chasing off the guys who say, "Oh, I don't need that."
Putting on boxing gloves and hitting a bag and calling it a support group really works.
Feels really good, yeah.
So this diagnosis was 7 years ago, and then just last year you had a brain implant, a deep brain stimulator. We call it DBS. We have some video of someone else's DBS surgery that we're going to pull up. But John, why did you decide to get the implant?
The tremor had really gotten out of control. It just had taken over, and it was starting to take over my life. And I wasn't at the point yet where I couldn't dress myself. I couldn't do the daily. I couldn't drive or any of that. But that was coming. That was going to happen if I didn't do something about it. I talked to Dr. Parwa, who's my neurologist, and asked him about it. And I think he thought I was ready, because he immediately picked up the phone and arranged me to have a meeting with a neurosurgeon and talk about the operation. And it's meant a huge amount to me. In terms of quality of life, it's been an enormous change.
And you're going to show us a demonstration here in just a moment. But first, Dr. Al, just how does DBS work, and who is it right for?
So DBS, we put the implant deep in the brain. In Parkinson's, it's in two specific spots, two common targets, the subthalamic nucleus and the globus pallidus interna. And we have found that constant electrical stimulation, high frequency, inside the brain can actually alter the brain cell activity. It can interrupt those abnormal tremor circuits. It can, what we call, modulate the ability for the body to create stiffness and slowness. And we just leave it on all the time, and it helps with the symptoms all the time.
And who's it good for?
People with Parkinson's. Often when we are thinking and seeing people with Parkinson's, we always have in the back of our mind, is this person at that point where they would be a suitable candidate for deep brain stimulation? Often it's when people lose or develop complications related to the medications that they're taking for Parkinson's. Things that we call dyskinesias, or extra abnormal wiggly movements that develop because of Parkinson's progression, making them more sensitive to the medications. Sometimes when people have very severe tremor and the medications only help with 50% of it, but it's still ongoing, people we consider those for deep brain stimulation. And then sometimes when people are taking the medications quite frequently, which happens as Parkinson's progresses, where they take it every 2 to 3 hours sometimes, then we talk about deep brain stimulation for them.
So, John, you brought your remote control.
Yeah,
Show us how it works.
I'll show you. Okay, it's on right now.
Okay.
I'm going to turn it off. And simulation is off. And
this is talking to your brain.
Yeah, it's off. So this is what happens.
Wow.
And that's what I was living with. And as a reader, it's really hard to hold a book and have your hand doing this, or even to focus on a page. And you can see the issues with trying to button a shirt or drive a car.
So now you're going to turn it back on.
Yeah, I will turn it on.
And you can't see under the table with the right leg's going too.
Yeah,
Okay.
You can't see it, but it is.
Yeah, it sure
it's
is.
like a jackhammer. It's just up and down. Okay, come on. The other thing about this is I can increase the intensity of the stimulation with this. I haven't needed to, because Dr. Pava's office has done such a nice job of, there we go. Okay, it's on again.
Okay.
And you'll see.
Wow. Okay, that's a wow moment.
Pretty remarkable.
Yeah.
Now, I had the surgery only on one side. I had it on the left side because I have a right dominant tremor.
Okay, because I could see a little bit of a scar back here.
Yeah, you can see that because it's running all the way down. There's a battery here in my chest. I will probably at some point need surgery on the other side, but one hopes that won't be for a number of years yet.
how does this impact your day-to-day life? Or how was it and how is it now?
Well, I think you can see how it was. It was getting where Parkinson's was starting to control me rather than me control it. The way it is now, I have not had to surrender any of the things that are important to me. I go about my daily life just as any of you do. I can dress myself, I can drive, all of those things are open to me now because of the surgery. So that's really the issue.
And you're a big traveler?
Yeah, and we thought 7 years ago that was out of the picture. And since then we've been to Europe, we've been to the British Isles, we've been all over. And
you going to pick up those grandkids a lot easier?
Well, they're
small one at least.
Yeah, they're getting older, so it's getting harder. But I'm at the stage now in life where you think about your legacy and how you're perceived later on, how these grandkids will look at me, and I want them to know that I fought and didn't accept this. I still am in control of it. It's not in control of me, and that's an important thing.
Well, and it's just like what I told you about my grandmother. It's
Yeah.
like really the memory that I have
Yes.
of her is sitting in the chair with the tremors and unable to really speak. And so to know that now where we stand with research and advancements, the grandkids get to remember their grandparents much, much differently now. There's also another treatment, Dr. Au, called focused ultrasound, something that we've highlighted on the show in the past, but it's something called brain surgery without the scalpel. How do you decide if a patient needs the focused ultrasound?
Yeah. The focused ultrasound, as the name implies, takes thousands of ultrasound waves. We're familiar with ultrasound in different aspects of medicine for your baby, for your heart, but they take the thousands of them and they focus it in one spot on the brain, actually the same spot of the brain that we put the DBS electrode in. And what that does is it creates a lesion, or said another way, it kind of burns off the cells. But just keep in mind, it sounds crazy because it's your brain, but just keep in mind it's the abnormal part of the brain causing the abnormal tremor or the abnormal symptoms. You don't need to make an incision or drill a hole through the brain, so it is nice in that regard, but it still is brain surgery. How we select people is often for Parkinson's, it's mostly the disabling tremor that we target.
I explored that first. That was the initial thing that I looked at, was that. And then Dr. Paula said, I think you'll be happier with the deep brain stimulation, so that's the direction we went.
So Dr. Au, last year the Michael J. Fox Foundation announced what they're calling a breakthrough. It's a test that can detect Parkinson's disease before the symptoms starts. It's looking for a key Parkinson's biomarker. How big of a breakthrough is it when we say it's a breakthrough?
I think it's a huge deal. Kind of making the diagnosis is kind of wishy-washy right now at best. John, you can probably attest to this. Kind of right now, it's a clinical diagnosis, meaning that we listen to the patient's symptoms, and then we take one look at you, examine you in a half an hour exam,
walk down the hallway and see how the gait is, and
the feedback that we get is that like, how can you be sure? Are you really sure about this? And the breakthrough is that we've been able to develop this biomarker looking for this abnormal protein that they find in Parkinson's called alpha-synuclein. We know that builds up in the brain, and the theory is that it builds up into the pivotal brain cells and neurons and causes the destruction and abnormalities in the brain. But we've been able to develop techniques that we can find this alpha-synuclein in other parts of the body. Michael J. Fox Foundation is working hard on this, looking at it in the skin as well as the spinal fluid. The skin is actually something that we've been doing in our clinic pretty recently, just in the past couple of years, where you can take 3 small punch biopsies, 1 in the back of the neck and then 2 in the leg. And in the initial studies, it had a 95% accuracy of kind of detecting and determining that it's Parkinson's disease. So we can take what we know now, the clinical exam and the history, but then if we have another adjunctive test to kind of help with the diagnosis, moving forward, I think that would help a lot.
Correct me if I'm wrong, but I would think that would also help the person slow the progression down, because they could start exercising. If they don't exercise, they could start exercising with the diagnosis, and they would be ahead of the game.
Yeah, absolutely. Yeah, kind of getting into that, kind of going through those stages, kind of accepting the diagnosis, saying, what do I need to do, exercising sooner rather than later.
Sooner,
And
yeah.
then hopefully in the near future we'll be able to have it in the blood, but just kind of with a blood test for Parkinson's, but that's yet to come.
We know we have Parkinson's long before it's been diagnosed. That's the case most of the time. I had those night terrors for years, REM sleep disorder, and that's a precursor to Parkinson's. And so to know these things helps you prepare better for it.
Yeah.
Touch on the GLP-1 drugs that might possibly be slowing down Parkinson's. This was another study that was looked at.
Yeah, this was this study that they're showing here, kind of just published in the New England Journal just earlier this month. These GLP-1 medications used in diabetes.
These weight loss drugs that we see the commercials for.
Yeah, they seem to, in Parkinson's, potentially they could reduce brain inflammation and potentially be what we call neuroprotective. Opposite of neurodegeneration is fighting against that, is protecting the brain from gradually worsening over time. And in this study, they looked at it in people with Parkinson's disease, and they found that after being on this drug, that compared to people that weren't on the drug, they didn't seem to decline in what they call the MDS-UPDRS, which is a lot of letters, I know, but it stands for Movement Disorder Society. That's the group that the Parkinson's doctors are a part of. And the UPDRS, Unified Parkinson's Disease Rating Scale, which is a scale that we do in the clinic. We watch you walk down the hall, we get you to tap your fingers, kind of feel your muscle tone, kind of assess your speech, and the higher the score, the more symptoms there are. So this is comparing people to after the drug, after the year, the year has ended in the clinical trial to before, and the people that were on the lexicantide seem to just be about the same, which is good. In a condition that's expected to decline over time, if you're maintaining what you have, I think that's a win, and people would say that is neuroprotective.
These breakthroughs also underscore the importance of people getting into clinical trials, which we do offer here at KU. There's a lot of opportunity for that. And whether it's successful or not, it's still a win because you mark off, well, that didn't work, we'll try something new. But I've been in a clinical trial here at KU for 6 years. And from what I understand is there's another 2 years that it's going to go on. So people should really look to the trials that are available and sign up and
you know what I love
advance our knowledge.
Is that you're a patient and you just referred to it as we here at the University of Kansas Health System. So we appreciate you sharing that.
Well, I will say this, and particularly going through the surgery here, I was stunned by the level of care that people have for the patients here. And it's extraordinary in that way.
Dr. Au, Parkinson's Foundation Moving Dates this Saturday, April 27th. What is that?
Yeah, that's the Parkinson's Foundation annual fundraising walk where people with Parkinson's, their caregivers, their friends, and the community really kind of gets together and we fundraise for Parkinson's. It's happening across the country, multiple sites I think this weekend, thousands of people. Ours is happening at the Liberty Memorial, so KU has a team, so come join us.
You can register at moviedaywalk.org. Go ahead, John.
This is the second walk since COVID, because COVID interrupted everything for a while. So they're starting up again in a lot of ways. Real important for people with Parkinson's to come out there, and their spouses, their families, and support this. It's a really good cause.
Let's get to some questions from our viewers. We've got several. Jean wants to know, what are the driving restrictions?
I don't think there are any per se. I think the restrictions that come from the individual saying, I don't feel safe driving at this point. And I'm okay with driving right now. Might change in a few years, I don't know. But I don't think there are any legal restrictions right now. It's a comfort level more than anything.
He also wants to know how often that battery needs to be replaced in your remote.
The battery that's a good question. It is good for about 5 years. I charge it up once a week. And I have a little device I just put here and let it charge up, but it's supposed to last about 5 years.
Charge it up just like an iPhone. Mm-hmm. Like it. Okay, what about medication given for Parkinson's? And if you are on medication or have the stimulator, does one override the other? Now that he has the stimulator, does he not need any medication?
Yeah, they work together. Often
Yeah.
people, when they get the deep brain stimulator, they were able to reduce the medication, but most of the time people continue it, even though there are a few people that do so well that they come off medications. But I would say probably 80% of people that get the stimulator continue on at least a little bit of the medication, but we're able to reduce it in most cases.
I'm on a real low dose of carbidopa, levodopa, because a higher dose makes me ill. I encounter nausea and fatigue, and so I work with my neurologist to get the right level for me, which is as low as you can get. And I take Rytary, which is, I take 3 doses a day. I guess we would call them doses, 3 doses a day. And that seems to work for me, and it's extended release. So it doesn't happen all at once.
So you just work to tweak and find the right dosage that works for you.
And that's real important, because everybody's going to react to the medication a little differently.
Kathy says she loves this show, so I hope everybody else is getting a lot of good information. I know I am. So Kathy, thank you for watching. And Joellen, that takes me to Joellen's question, which is, does this disease run in families? And I have to tell you, when I told you my grandmother had it, and when you said you had these night terrors, my dad has the worst night terrors. I mean, screaming, and it kind of made me get a lump in my throat when you said that, because I thought, does that mean Dad's getting it?
The good news is, and Dr. Al may have correct me, but I believe only about 8% of Parkinson's people are genetic.
Yeah, we think about 10 to 50% people have a genetic form of Parkinson's.
10 to 15, you
10
said?
to 15, yeah,
Okay.
10 to 15, yeah.
So pretty low.
So yeah, most people we see don't have anybody in their family, or if
I
they
have
do
no,
have somebody.
I have no markers for Parkinson's. So
genetics,
my
yeah.
children, grandchildren really don't have to worry about it catching it, so to speak.
Yeah, even in families that we see that, the mother and we also see the daughter had Parkinson's, we do the genetic testing, we don't see anything for the most common genes at least.
And lastly, any connection between Parkinson's and heart issues that we know of?
Not typically, not typically.
All right.
Yeah.
What's the biggest takeaway today, Dr. Al, you want people to go home with, if you will?
So I think, we hear about these news about different things, slowing down the rate of Parkinson's progression. I would say I would be cautiously optimistic. This is exciting news, the weight loss drug for Parkinson's. I think it needs some more research. It's not that we recommend weight loss drugs for all people with Parkinson's, just because the maintaining weight in Parkinson's can be a little bit challenging, and some of the side effects of nausea and vomiting with these drugs can be difficult to manage in people with Parkinson's. But what we see here is kind of early. We see it just in most of the research that has been done with these medications that have only been kind of 6 to 12 months. I think this gives us a springboard to see, hey, if there's only, if it maintained things at a year, does it maintain it at 2, 3, 4, 5 years? And I think that would be a bigger difference. And then we would be able to kind of recommend it for people with Parkinson's.
Yeah, driving home the point of how important enrolling in clinical trials
yes,
really
people
is.
Ask, how come it's taking so long? Well, one thing that can speed it up is if people join in the clinical research, just like John has.
Absolutely.
Yeah.
John, what's the biggest takeaway from your story?
I would tell people with Parkinson's that you can live well with Parkinson's, but you have to take control. You have to move. And if you do that, you can live well. And that's what I would say.
Thank you for being with us and just being a good advocate, and just a good, you just were full of a lot of good information today, so thank you for being with us.
Thank you. Pleasure to be here.
Yeah. Dr. Al, thank you.
Yeah, pleasure.
And thank you to our viewers for being with us today. We'll see you back here tomorrow at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts.